From India to Nicaragua and points in between, faculty from LSU Health Shreveport have been taking their medical skills to people in underserved areas all over the globe.
Many of the places that are ideal for medical missions are places that may have medical care, but it is extremely minimal access to care, and many times the medications are so expensive and the average person can't afford just routine maintenance. Over the years, we've done mission trips in Venezuela, Honduras, and for the last several years, through my local church, we've found a missionary in Ecuador and have done yearly trips to Ecuador, to that region of the world. We will bring about 4 physicians on this trip, with a whole support cast of people that will serve as pharmacists, triage nurses. We'll have interpreters actually there, and some bringing with us to interpret into Spanish for us. So it's a whole team effort for sure. And so it's important, I think, to see how some other parts of the world, people in those parts of the world live. I've never seen anybody come back from one of these who didn't look at their own situation through different perspective when they come back. For me, it's rejuvenating time. It's a time when I come back with a renewed perspective, and it makes me feel much better about doing my day-to-day work here.
Medical students have continued this outreach with their Global Health Initiative elective.
For the past 6 years, we've gone to Bungoma, Kenya. It's in the western rural area of Kenya, in which we do mobile clinics in medically underserved areas. A lot of students choose this in order to put themselves out there and do something that they've never been able to do before, or also gain a deeper understanding of humanism in medicine and what it truly means to practice medicine either at its roots with limited resources or in an entirely different area in which you may have never been exposed to before. It's important for students to be able to adapt to different situations and really improve the way that they're able to practice medicine and experience the healthcare system in the United States when they're able to compare and contrast it with different delivery of care in areas such as Western Kenya, where we go. It was a huge effect on the type of medicine that I want to practice. I'm interested in primary care, I'm interested in acute care, and a lot of those aspects of medical care I got to perform while I was in Kenya, but it also kind of grounded me in the concept of I truly want to care for the individual, the patient, and it's just as rewarding to provide medical care in a situation in which you have limited resources just as much as it would be in the United States, where a lot of times it seems like we have endless resources.